What's up, guys? Stratton Polson here, your favorite chiropractic intern. And I'm leaving the clinic today in a conversation that came up with one of my patients and has also come up on some social media posts recently is posture. So there are devices out there like harnesses that hold your shoulders back for our desk workers and office workers. There's things that connect to your phone app and they go between your shoulder blades, and every time you hunch forward, it buzzes and gives you a reminder to sit up. And the question that was asked to me by a patient is, can these actually help you improve your posture? And the short answer is no. But the more involved answer is yes, and depending on what it is that you actually want. So when we talk about posture, one of the things that we have to remember is that you have conscious processes in the brain, cortical processes, where you can control them with your thoughts, or they can be changed and affected by your conscious thoughts. And then you have subconscious or subcortical processes, which are basically running underneath your awareness. Posture is largely controlled by the cerebellum, the vestibular system, and the motor cortex. However, the cerebellum and the vestibular system are subcortical, and so therefore they are subconscious. The processing that happens in those centers is not affected by or driven by your conscious thoughts. And so because of that, posture is more of an output based on the state of the body, what it's receiving visually, and your proprioceptive sense of where you are in space. So thinking about having better posture, sitting up straight, is only going to work temporarily because it's a conscious thought, not a subconscious operating system. So these things have varying levels of effectiveness. So when you look at the buzzers that go between your shoulder blades, and then when you slouch forward, they buzz and remind you to sit up straight, those reminders can be great if your goal is to remain sitting up straight while you're working at your workstation. But it's not going to give you any type of long-term postural benefit, and it's not going to change your resting posture. As soon as you're not thinking about it anymore, you'll go back to your normal kind of slumped forward or whatever the position is for you, and you won't go back to a good posture until you're reminded again. And that's because these reminders work at the conscious level, the level of our thinking and our thought processes, rather than subconscious level based on just our system's ability to hold good posture. Then there's things that are even worse for you. So the harnesses that you put on, they're kind of like shoulder straps, and they actually physically pull you into an upright posture. Those are not good for you at all. And the reason for that is that the muscles that actually help you maintain an upright position, those are typically weak in people who slouch a lot. And if those muscles are weak, putting a brace is actually going to allow them to be further weakened. So it has the opposite effect. Just like if you put a cast on your arm and you leave it there for a month, the muscles in your arm actually atrophy, they become weaker, and then you may even need rehab or strengthening protocols to help bring the arm back up to where it was before you put the cast on. Bracing does the same thing. So, and this works for any joint in your body, by the way. If you wear a knee brace all the time, the muscles that support the knee will become weak and you'll have even more problems. If you wear an ankle brace, a back brace, those muscles will become weak and you'll have more problems with the joint. So bracing are temporary solutions, and those harnesses would be probably the worst solution that you could choose for desk or sitting or working posture. So the reminders aren't that great because posture is more of a subconscious process, and constantly thinking about it is only good for as long as you're trying to remind yourself to sit upright. A better solution would be maybe to have a mirror behind your computer or near your computer so that every time you see yourself, you can see the posture that you're in, and that will be a good cue. But again, that's going to be temporary because it's coming from conscious thought. The best way to improve your posture is to use targeted physical therapy type exercises and movements so that you train your brain's motor pattern, and so that you train the musculature to be able to support you in a better, more upright posture more often. And one caveat before I end this video, there is no such thing as a perfect or an ideal posture. Some people will naturally have a little bit more of a slouch. Some people will naturally be a little bit more upright. And as long as that posture isn't sustained for long periods of time, or that posture isn't causing you any type of dysfunction or pain, that's totally fine. There's a lot of variation between people and their bodies, and there is no ideal posture that we should all be trying to fit into. That being said, posture is related to pain and posture is related to dysfunction. So if you have a severe forward head carriage and a severe kyphotic angulation to your posture, your back kind of rounds and humps, you are more likely to be the type of person who will experience neck pain, shoulder pain, and those types of conditions. So although posture doesn't always cause pain, posture can affect your levels of pain if it's poor. So I would encourage you to see a doctor of chiropractic, a chiropractic intern like myself, or a physical therapist so that we can help get you into motor pattern training and muscular training to help you hold good posture at a subconscious level, so that posture just becomes a natural output of the system that your brain is running. Your script and your movement planning will result automatically in an output of good posture, versus constantly reminding yourself and doing short-term solutions that aren't going to give you long-term results. So if you have any questions about posture, pain, or you'd like a consultation for chiropractic care, go ahead and send me a message and I would be happy to help you. This is once again Stratton Polson, your favorite chiropractic intern. Have a great day.